I know that you all have heard a lot of negative things today, and there's a lot of things about medicine that make you really scared, but I'm going to tell you that you're exactly where you need to be. Being a physician is the best job there is, bar none. And the really great thing about medicine is there are many rooms in the House of Medicine. So if you don't like one room, you can go to another room. You can find a room you feel comfortable in. The thing that you're hearing about and the thing the government wants is for you to go in their room, and they want to pay you and they want you to do things the way they think it should be done. But it doesn't have to be that way at all. Let's see. Okay. So here's a nice Benjamin Rush quote about facts and the heavens and the really important thing in medicine. That's like half of it, but that's okay. All right. So when I first started, I actually was an advertising major first. And I went to New York and did advertising there. And when I did, I was really bored. So I volunteered in the hospital at night. One of my friends was an EMT, and we came on an accident one day, and he jumped out of his Jeep, and he had this kit, and he went and saved these people, and I was like, that is so badass. I want to do that. And he's like, it's really kind of easy. You just take this class. It's like 20 hours after work, and you can do it. So I did that, and I completely fell in love with medicine. So I was working at the ER at night for fun, and then I was working doing advertising during the day, which was not fun. And one night, I was thinking, okay, we really need to, position our product here and make sure more people buy Tide than Cheer. Wait, more Cheer than Tide. Oh my God, are we Tide or Cheer? And I realized that it didn't matter. Like, everything I was doing at work didn't make any difference at all. And then I would go to the emergency room where I knew very little, and I could make a huge difference. And actually, when I started, I would get really pukey. And actually, my first, 4 weeks in surgery, I would get really pukey. But I somehow worked through that. But I would still know. Like, one time we had a guy with a compound femur fracture, and I was like, oh God. And they're like, come here, hold traction. I was like, ugh. I had spaghetti for dinner, and they're like, just hold traction. So I remember doing that, and when I pulled, the guy was like, oh, and he felt some relief, and I was like, this isn't gross. This isn't a disgusting bone coming out through skin. This is a guy. And I just made him feel a lot better. So that's when I just totally fell in love with medicine. So when I first started, I worked in the emergency room for a while after I got out. It was Med-Peds, but I did ER just to make some money and try to make a living. And as I did that, I decided, well, I'm going to open my own practice. So I went to go open my own practice. I got all these contracts from Blue Cross, Blue Shield, Humana, and I read them. I'm like, this is crazy. Nobody in advertising would sign these. They wouldn't, So there were contracts that said that, they could change their payment to you at any time, that they could change the responsibilities, that you basically had to be a slave to them and do exactly as they said. And I just struggled through 8 years of practicing medicine, getting through school and residency. I'm like, I don't want to do what they say. I want to do what I was taught to do. So I just thought about the different possibilities. I'm like, people pay, and no one else was doing this at the time, but the old doctor who took care of us growing up just had fee for service. We would pay him. If we were sick, we'd pay him. If we were really, really sick, he'd come to our house and we'd pay him. So I thought, maybe I can do this. I'm in a small town. People pay for haircuts. They pay for car washes. Why wouldn't they pay to come see me? So I talked to my dad, who's a CPA, and he was extremely disappointed. He was like, you went through all this school and you're not going to be rich. I was like, I don't know if I really care if I'm rich. I think I really care about doing what I want to do and taking care of people. So I started this practice. I was still working in the ER. I worked there about 3 months until I got into the black. So I was only in the red for 3 months because I just do what I say. People come in, they're sick, they pay me, they get better. If they don't get better, I see them for free. I have them come back because I don't want to worry about them. So we do a thing in my office called a BOGO, which is buy one, get one. So, and I do a lot of them because it makes me feel better. Like, I'm like, if you're coming back for you, I might charge you. If you're coming back for me, I'm not going to charge you. But it works, and it works really well. And like Beth was saying, I have 2 billionaires in my practice. Okay, there's not that many of them. I have 2 billionaires who come, and I have a lot of very, very poor people. I have a really interesting mix, but all of the people in my practice are very independent-minded and people who want to be in charge of their own health care. And it's really interesting to see that range. And some of them are people you wouldn't think would care, but they do. They care a lot. So as I've done this, this is my 14th year to do it. So I'm going to go through some of the things that patients hate. One thing is they hate being treated like a 7-digit code. They don't want to be a code. They know they're a code. They know that when a lot of doctors see them, they put them into a little box. My business has increased significantly. I actually had to close my practice and not see new patients, which I try to open it because I think you should always have fresh blood, but literally, right? Anyway, because people who are on Obamacare a lot of times will come back to see me or come to see me for the first time because they don't feel like they're getting good care. They feel like they're a code or a number. People also hate not being able to get a second opinion. Nowadays, very few people can get a second opinion. Just like the last doctor was talking about his wife with infertility, you can't really say like, hey, is it okay if I go see someone else? For one, no insurance is going to pay for you to see 2 specialists. For 2, it's just not done. It's almost offensive. So I actually am like the second opinion a lot of times in my little town. People hate now when you call a doctor's office, you get a message that says call 911 if it's an emergency. Duh. Like, who does that help? That doesn't help anyone. Everybody knows to call 911. My machine doesn't say that. It says call Dr. Madrigal at home. Duh, if you're bleeding, you're going to call 911. If you're good enough to call my office, you're probably good enough for me to call you back. But people don't want just an answering machine that tells them something silly to do that they already know. They also don't want an insurance clerk refusing them treatment if we've ordered it. So what you guys are doing and working so hard to learn is when you need a test, what test you need. And when you get out, they're going to tell you can't do that. They're going to tell you, unless you have, right lower quadrant pain. I had this last week because I do have to work with people who have insurance. I do have to get some tests authorized. That's my only bane of my existence and prior auths, which we'll talk about. But I had a person with right lower quadrant tenderness. I said clearly they need a CAT scan. I think they have appendicitis. The insurance company wouldn't pay for it. Okay, why won't they pay for it? Well, I don't know. They wouldn't pay for it. Okay, how can I talk to somebody? Well, you have to do a peer-to-peer, doctor-to-doctor thing. So I talked to the doctor. I'm like, right lower quadrant tenderness, needs a CAT scan, thinks appendicitis, vomiting, fever. You know, it's been going on for 12 hours. He's like, ooh, you didn't document rebound. I'm like, okay, rebound also. He's like, great, we'll get it. But that was really a pain, and that took me about 2 hours to get. And it really, we know when a person needs a CAT scan. We have a lot of training for that. And why would I want to just order a CAT scan for fun of it? Okay, I wouldn't, right? So patients know this happens, and they hate that. And again, then in the meantime, I'm worried this person's going to die while I'm waiting, or while they're waiting. They also hate waiting in the waiting room too long or in the exam room too long. Okay, those are the main things that I hear that they hate. Let me tell you, which you already kind of know, but we'll breeze through it, what doctors hate. We hate paperwork, okay? We go to school and work way too hard to have to do a ton of paperwork. We hate the uncertainty of healthcare. This is one of the reasons I tell my daughter I don't want her to be a physician, because I don't know what's going to happen next, and it's really not fair that we work this hard and we really don't know what direction or if we're going to have our hands tied and have to do something we don't want to do. We hate battling insurance companies and the hassle factor. Nonsense computer forms. I don't know. How many of you guys have already worked in a clinic? Some. Okay, so on those, do you have to fill out a certain number of boxes, a certain kind? Okay. We hate that. That doesn't make any sense. That doesn't have anything to do with illness or wellness. Explaining the need for expensive testings to insurance representatives that are uneducated or undereducated. Because sometimes when you call, like I said, they don't know what you need. They just know you can't get it. Wasted time coding visits in order to be reimbursed. This is actually, you can't even see the top of it, but this is actually the Obamacare law. Like, seriously, like, that would take you another 4 years of school to learn, to read that stupid thing. We also hate ICD-10 codes, or the old 9s, the new 10s. Okay, like, these codes are really insulting to me. There really is a code for struck by turtle, initial encounter, struck by turtle, subsequent encounter, and struck by turtle, sequelae. Like, why? I find that very offensive that somebody has taken time to put this in a thing that I'm supposed to care about. Like, I've never seen this. I've seen no patients hit by a turtle. Yeah, okay, you can't see this one, but there's actually a drowning and submersion due to falling or jumping from burning water skis. Like, for real, like, why are these codes? And I actually did a Google search on this because I'm like, maybe one person did it. Like, there's no accounts of people being burned by water skis, but I did find this picture, which is cool because that guy is at risk. So. But that's the other thing, is we have to go through all these codes and try to make one fit. And now the ICD-10 codes, there were tons of them. Now there's 10 times as many with ICD-10s, and they still don't fit. You still have to make them fit. There's one code for bit by a macaw. There's another one for bit by parrot. And hypothetically, if you do the wrong code, you're being fraudulent. Like, that's ridiculous. And again, why should I waste my time trying to figure out what kind of bird they were bitten by, you know? And we also hate not having enough time to spend with our patients, because that's where the good stuff is, most of the time. Okay, so what I do I didn't know about Benjamin Rush when I started, but once I read his philosophy and how important it was to him that there's a doctor-patient relationship without anything in there, no insurance company between you and the patient, no government between you and the patient. I was like, that's exactly what I'm for. So I just have a fee-for-service practice. So when people come in, I charge them money. That's it. If they can't pay, I a lot of times don't charge them. If they can do something, I prefer them to do something. So we get eggs. We got a goat one time. Not a good idea. We lived in the country at the time. People wash my car for me. People cut my hair. People have babysat for me. People dry clean my clothes. Like, I'm really rich. You know, like, yeah, I might not make a bajillion dollars, but I have whatever I want. Absolutely. You know, and I'm kind of a big deal in my town. And I do, well, I'll see. Oh, here. I give a discount to teachers and preachers, and it sounds really good. But I also do it because those are my best referrals, right? Who talks to the most people? Teachers and preachers. And they love that they get a discount. And a lot of preachers, actually, they don't have to opt into the Social Security system. So a lot of them actually don't have Medicare. So it's a great deal for them, too. Also, in teachers, I stay late. I save my 4 o'clock to 5 o'clock appointments for teachers. I save my Friday appointments and Monday early for college students. Like, we have a lot of little things like that that work really well. Anybody who has cancer, we see for free. Originally, we would just see people that we already knew who got cancer for free, probably some guilt thing I had. But now, if somebody has cancer and it's a friend of a friend or somebody knows about us, we just see them for free. And a lot of times the oncologists will call me and they're like, I'm not very good with antidepressants. This lady's got really, metastatic breast cancer. Can you see her? I'm like, absolutely. It's just one less hassle for the patient that is extremely rewarding for us. BOGOs, like we talked about, buy one, get one free. I also do BOGOs sometimes, like with my really big families. If they have like 5 kids and they're all sick, I'm like, how about we just split down the middle? I'll charge you for 2.5 kids. So, well, some of it's just practical. Like, even if you had insurance, if you had to take 5 kids on a copay, that'd be a lot. So I'm like, we'll work it out. And it works. I do house calls for really sick people, usually it's people who have cancer, people who are at end of life. But sometimes, like the other day, it was a mom who had a really bad migraine, and she had a newborn and a 3-year-old. I'm like, I'll come over there and give you a shot. You're good. Give her a shot of Imitrex, a little shot of Zofran, we're good to go. You know? So that's huge. Because you can imagine somebody with a really bad migraine trying to schlep 2 little ones into the office. I can go over at lunch and do it. Oh yeah, $5 off if you come in wearing spurs. I love that one. So, it only happens like twice a year, but I just love it when it does. Patients call me at home, so I do some of the stuff that the concierge practice does, but honestly, I don't do it because of that. I do it because that's what my doctor did. Like growing up, this isn't new. Like people are like, wow, you're so cutting edge. I'm like, this is exactly what the doctors did like in the 40s. So if people are sick, they call me at home, and I know them at this point so well. A lot of times I know what medicines they're on. I know what they're allergic to. I know their dog's name. Like I would rather them call me at home than go to the ER and get some craziness happen, you know? Now, sometimes I'll send them, but I don't mind them calling me at home. And every single phone call I get starts with this: Dr. Madrigal, I'm so sorry, but. So none of my patients are overly entitled. None of my patients are mean to me. None of my patients feel like I'm, you know, chained to them. They actually appreciate it. So I don't mind getting those calls. I just never do. So. And I can fix stuff before it gets bad. You know, they're like, you gave me a medicine, now I have a rash. Well, I want to fix that. I don't want them to go to the ER and them go, she gave you the wrong medicine. I want to fix it. So I like getting the calls. We don't gouge prices, and we don't gouge the patients. So for example, back to my dad being like, oh, like a CBC in my office, we work with a lab company, and a CBC cost us $3.50. So we charge $12.50. That's my biggest markup right there, actually. Most are right at 100% only. But at the local hospital and at actually one of the charity clinics, if you don't have charity care, if you're not on Medicaid or actually signed up for care, it's $149 for a CBC. So it's pretty good. So yeah, in my office, you can get a CBC, a complete metabolic panel, a thyroid, and a lipid for and the draw for $98. If you go to our local lab, it's $1,000. It's right under $1,000. So if you don't have insurance, or you have insurance with like, for a while I had Obamacare with a $6,000 deductible, I would have to pay $1,000 if I didn't know about me. You know what I mean. Okay. Oh, and every patient is a VIP. All my patients, when I started, I was kind of kidding and just being like, oh, you're the most important patient, which was really easy when they're like 12. But we actually just carried it on, and every patient really is a VIP. If you can call your doctor at home, if your doctor knows you, if your doctor knows what medicines you're on, and your doctor cares about you, you're a VIP. That's a big deal, I think. And that's better than, I think it's better than concierge, but concierge definitely has its place. I prefer just the old-fashioned way. But why it works. Because the people are in charge, I can't read this from that far, but I'll tell you why. Because the people are in charge of their own health care. There's something to the fact that people are paying and getting what they pay for. I have extremely compliant patients. So if you could go see somebody for free and they could tell you all these things to do, you might or might not do them. If you're going to go see somebody and you're paying $75, which is my regular office visit, by the way, which is pretty reasonable, but still, if you don't make that much money, $75 might be a lot. You want your money back. You want a good return on investment. I have ridiculously compliant patients. I mean, it's so much fun. It's so much easier. What else does that say? Oh, that I have people, I have the billionaires, and I have some like migrant farm workers. I have a lot of people from Mexico who come over, and they all get treated the same way. And I love that. Absolutely love that. Because both people know they need to be treated better in medicine, and they both get treated better. So I absolutely love that. And that the one that I pay, the person who pays me is the person I'm responsible for. So again, if an insurance company's paying me and the patient doesn't get better, then I need to see him again and I'll get paid more. So it's really in my interest not to do that good a job. And like one of the places I worked right out of residency, they said only do one problem. So people would come in with 5 problems and you just tell them, what's the most important problem? Well, a lot of times, if a person feels really run down and sick and just don't feel good, it might be because this is the anniversary of their daughter's death, or their husband just lost his job, or they actually have a stomach ulcer thing going on that's a stomach pain, but that's another problem. So there's a lot of times we're like, let's treat the whole patient every time. But where I worked before, they're like, no, we need to get them in again because we need that copay again. We need that copay again. We hardly get paid anything from Medicaid, so get them back in again and again. So I like this, that I'm accountable for the person. And it's in my best interest to get them well and get them well quickly. That really is one of my techs, actually, too. I mean, that's how our office is, and I kind of feel like that's how it should be. Like, I think I was doing a pap on her mom, you know? Like, we're just like, give me your baby. But because of this, too, I have less staff. We don't waste a whole bunch of time on the telephone doing coding and claims. My friends who do take insurance have 2 or 3 people that just fight with insurance companies all day long. I don't have anybody who does that. As a matter of fact, sometimes, like when people's insurance companies won't pay for like a drug, I just tell them, like, your insurance company won't pay for it. I'll give you something different or you can pay for it. And about 50% of the time, they want the drug anyway and they'll pay for it. But I can't deal with that. You know, it's just I'm like, call them. I went to do a lot of school to figure out what drug you need, and this is the one I feel like you need. I don't want to make you try 3 other drugs that I know aren't going to work first, and that's what prior authorizations make you do. So I have no accounts receivable. So I have a certain amount I have to meet every day to make my overhead. Whatever's left in the cash drawer goes home with me. Not exactly, but pretty much. My dad would be, la, but pretty much that's it. So a lot less paperwork. And most of my time is spent on patient care. About 95% of my time is spent one-on-one with a patient. It's so awesome. That's why I went to med school. Okay, so what doctors love? We love spending time with our patients. This guy actually was on the second wave on the Normandy invasion. Okay, like if I worked at a place where I only had 6 minutes to spend with the patients, I would not know that. This guy he just recently died. He was my oldest patient, but he's really cool and he was really sharp till the end. That, again, I'm rich. I know these people and I know them well. They like taking care of generations of patients. We don't even mind taking care of the difficult patients. So I was reading a thing that said, what do doctors hate? And I thought it was going to be like death, illness, difficult patients. It wasn't. It was all those other things I showed you. It was paperwork mostly, and the uncertainty of where we're going. Like all these other things, they're hard, but we like it. And we do well with it. And that's why we go to this field. Not everybody can deal with death of people. Not everybody can deal with really difficult cases. And you're a certain type of person who goes into medicine who can do that. And it's nice to be able to do that. Non-compliant patients. We don't even mind them. This guy clearly has diabetes and he eats way too many cookies. This guy, actually, his wife died last year, and he started dressing up as Santa Claus, or I guess 2 years ago. So he started dressing up as Santa Claus. This was his 2nd year. He is into it. So, I love it. One of my patients, little one, saw that on Facebook, and he's like, please tell me he's okay. I was like, no, he's just getting a checkup right before he goes. We love loving on our patients. And that's the thing, too. If you don't have time constraints, you can actually love on your patients. Empowering the patients. I came back from lunch and found this. This is one of my patients who's actually a paraplegic, and he gets recurrent UTIs. So at lunch, he just wheeled in there, left a urine, and left the money. How great is that? Later he texts me, he's like, call me and tell me what it grew out this time. Letting our patients love on them. Oh, that guy did stained glass. He does stained glass in my house. Isn't that cool? So that's what I trade him for. This other lady is 82 years old, and she does trapeze with me. She's my idol. She's going to the Amazon next week. I'm like, oh. So, But that's the other thing that's really nice about where I work is that the patients can love on me back, and it's totally fine. So I have 2 babies. One of them is in here. Oh, happy work environment. You can hire who you want. I don't have to have a bunch of people who are not happy. I have 2 babies named after me. That's one, Julieta. And then there's another one who, she's the 12th child, so I think maybe they just ran out of names and maybe it's a coincidence. But they named her Juliet. And her whole family, they're homeschoolers, they're very, very conservative. And this one is wild. She cut her own hair the other day, and she was on the roof. They were doing something to fix it. She climbed up on the roof, and she was wearing a tutu. I'm like, that kid is supposed to be named after me. So they brought her in, and they were doing something, and the mom was like, Jules? And both of us go, yeah. I'm like, you call her Jules? They're like, we kind of had to. So. But still, what a cool job. Oh, helping wherever we're needed. This is when I was in Peru, that guy didn't do very well, I don't think. But that's a really cool aspect of our job, too, is that we're always doctors. Not that many people have a job where you can do it all the time. You can't do advertising all the time. You can do this all the time, and you are really important. Look how bossy I am, even not in English. Like, I'm bossy. We like doing charity work around the world, and that's the other thing that's really nice. Like, a lot of my friends, I'm like, why don't you go on a charity trip with me? Let's go on a mission trip. They're like, I do tons of charity here. I take Medicaid. And they're serious. They feel overtapped already. But I love being able to do this kind of thing. That kid is so happy. We gave him, she had this little piece of paper that was like a doll that she was playing with, and we got these like 99-cent little animals and gave them to these kids. So happy. What a cool thing. We don't even mind dragging our kids with us to the hospital. And that we don't. I don't think any of you go into medicine not meaning to sacrifice. You know you're going to sacrifice. My kids know I sacrifice, but they'll do it, and they like it. They have a much richer life, too, as a result. And that was the baby we were waiting for to be born. So I didn't deliver, but it was one of my patients who had a lot of other problems going on. I know her really well, so my kids know her well, so they wanted to see the baby being born. That's why we spent the night at the hospital, but it's kind of cool. So, but they've been there at other times, too. They've made, one time we were going out of town on a trip, and one of my patients who had end-stage metastatic lung cancer with mets to the brain was in status epilepticus, and it was going to take hospice about 30 minutes to get there. It was going to take us about 10 minutes to get there. So we just went by there on our way out of town, and they both had 2 friends with them, and I just mainlined some Valium because that's about all we could do, and which worked, thank God. But that guy ended up dying later that night, and my kids were really moved by that. And I know not every little kid should probably know about life and death, but I feel very, very honored that my kids get to, and that they get it, and that they know that it's an important thing and it's going to happen to everybody. And again, I just feel like they're a lot richer. When my son, after that happened with that guy, they had a thing in school. He was like in 5th grade, and it said, "What am I the most proud of?" And he wrote that we were rich. And I was like, you know, so we're in this small town. But then when he wrote that we were rich because we have so many experiences and that we know so many people, and that he thought we were famous at the time too. But and we are in the small town, but I don't know. I just think it's such a great job. Oh, and we also like having some of our own time. And that's the other thing, that the job I have now and the way I do it with just the patient and the doctor, I have time to be me too. And this is what I do for fun, is I actually do flying trapeze. But I have time to do really cool stuff, which again, a lot of my other friends are just so burned out that they don't have time. And one of my friends she's up at her clinic till 9 o'clock at night doing paperwork. She sees her last patient at like 4:30, and she's there at 9 o'clock doing paperwork. You don't have any time for trapeze if you do that. And you really don't have time for your family either. So again, there's really great ways to do this, and this is a great job. I think the whole thing about love is definitely true, but it doesn't even have to be that ooey gooey. You can just find cool stuff and do it. So to me, just putting you and the patient in a one-on-one relationship and making sure that nothing gets between that is what's the most important thing. And you guys can do it. Don't let the government, don't let the insurance companies tell you that there's only one way to do it, because there's not. There's not that many of me, and some of us aren't as loud as me, but you can absolutely do it, and you should. Do you have time for questions?
The only thing I want to say is, so I can give it maximum time for the questions, is, so we're going to go from here back to the hotel?
Yes, and then you meet in the, so we're going to go back to the hotel, meet in the lobby at 6, and we're going to Uber, and we're going to Uber over to GW.
Okay, so that's all you need to know, and that's my closing remarks. So let's just do the rest of the closing remarks.
Don't you like speakers who finish a little early?
Yeah.
Questions? Go ahead. There's one here too.
Thank you for your presentation. How many patients do you get to work with?
Okay, my practice has 5,000 patients.
And how many doctors in that practice? One. Wow.
One. So that being said, a lot of my patients have insurance, and a lot of them go to other doctors and then come to me for second opinions. But I've been there so long that a lot of people, I still know them. Do you see what I mean? Like this week I saw a guy I haven't seen in 7 years, but I still know him, you know, and he needed a second opinion about something. So I have a huge practice, but I see about 20 patients a day, which I like. I like boogieing. There's another guy who's in the same office as me, and he does the same thing I do, but he does more goats and chickens and home-cooked meals. He does a lot more trade, and his patients are more, he has more of the poorer patients. I have more middle-class, independent workers, and more of the Mexican population because I speak Spanish. But he does more of that, but he only wants to see 12 to 15 patients a day, and he makes a good living doing that. Oh.
Basically, essentially just answer my question.
You're welcome. Anybody else? Right behind you.
Hi there, Ryan from Rowan University School of Osteopathic Medicine. It's really interesting that you set up your practice this way. Were there any legislative issues that you ran into, like from your state, that tried to prevent you from doing that?
Yes, and that's why I'm really loud, and that's why I come to DC a lot. Because I definitely think, in the beginning especially, it was really hard to opt out of Medicare, for example. Originally I took Medicare because when I graduated from med school, you were automatically in it. So I just kind of kept it. And then as it went on, I didn't want to do that anymore either. So I opted out, and it was really hard to opt out. And I still have to have every single one of my patients over 65 sign a contract with me that the government has access to, showing that they understand that they could get their care cheaper, but they choose to pay me. So, but I think all the time, that's my biggest worry, is that there's going to be some legislation that's going to make me not be able just to be an old-fashioned doctor. So.
Thank you for your inspiring talk. I think you just gave Dr. Vino a bunch of ideas because he's just going cash now.
Oh, cool.
I have a couple questions. First of all, do you see patients at hospitals?
I did when I started, and I actually never charged for that. Actually, what happened is originally I was charging people for that, and then I had this receptionist who wasn't particularly good, and I found this giant stack after she left of Medicare that she never got reimbursed for. And I was like, well, clearly we're paying the bills without that. So then I just did what I called I would just go up there and just see them and not charge for them. But now my hospital actually has really good hospitalists. So now I just do what I call howdy rounds, and I just go up and see them and go through the chart. I have consultative privileges at 6 different hospitals just to make sure that A, I know what's going on, and B, they know that I'm still there for them when they get out.
So you do have consultative privileges without accepting insurance?
Correct. And you can do it without accepting insurance too. It's just, it is work. And you can, the other guy next to me, he goes up to the hospitals and he just sends them a bill. But he usually charges them about the same amount as an office visit, because he's like, well, I feel like it's partly my fault they're here, but which isn't necessarily true. But I mean, he just charges them like $100 to go in and see him, and he does have hospital privileges.
And then my second question is, I'm thinking about practicing in an urban setting.
Mm-hmm.
How would, if at all, how would you tweak your model to apply to an urban setting?
Probably not at all, honestly. It would probably be better because you'd have more people to draw from. That being said, when I started, there was a lot of word of mouth. So sometimes you do have to find the little pockets of where you are. To me, the kind of doctor you're going to be best at is taking care of the kind of patients you like the most. So if you can find that pocket, like for me, one of my big pockets is the Hispanic community because they're very underserved where I am. I get the culture. I love the culture. So once that started, it went crazy. So if you can find a niche that you're really good at and get that it doesn't matter where you are. But that's what I would say. Go for a niche that you enjoy and let it blossom.
Even the house call?
Yeah, even the house call. I mean,
Them allowing the
yeah, well, that's partly why I moved out of the small town because I would show up so much. But and my husband didn't like it. My kids didn't like it when people would puke on their beds and stuff. And I sewed somebody up in the living room one time. They're like, ah! But no, you could still do house calls. You just have to be careful. And like, I take someone with me when I do a house call, always. So you would just have to be careful and already know the patients. You couldn't just do I don't think you could safely as a woman do an open house call policy. So, and I don't do house calls unless they're already established patients too. But I always take somebody else with me. You seen Patch Adams? I don't want to be that. So, any other questions?
Nope. Okay.
Does this model have any implications for malpractice insurance? I mean, does it make it more expensive, less expensive, or?
I think it's the same. I mean, I feel like I'm less at risk for being sued because, again, I really have time to communicate with the patients. And again, if they're not getting better, I tell them to come back in for free. But malpractice is the same. Some people don't. Again, there's other people who are really off the radar and don't even have insurance. And one of my friends doesn't have malpractice insurance. He has a sign in there, if you're planning on suing me, good luck, kind of thing. But I'm not like that. So I'm a little more cautious.
Anybody else? Okay.
Cool. Yay.
Yay. So we'll see you guys over at the hotel.